I'm going to talk a little bit about public health and crime. You know, commercialization will increase public health risk and safety. You know, Greeley, Colorado, where the University of Northern Colorado is, it's kind of very rural, cows, you know, farming. They actually started a campaign, marijuana is not harmless. Why would a city in Colorado do that? You know, and when we voted for Amendment 64, and people don't really understand this because Colorado's in a box, you know, it's a square. When we voted for Amendment 64 for recreational use, you know, it passed by 55% or what have you. 72% of the municipalities in the entire state said, we voted for it, but we don't want it in our community. 80% that happened in California, 80% that happened in Michigan. Detroit opted out of legal marijuana. Detroit, really? I was shocked. Colorado, you know, we have, our law enforcement are really busy. You know, we're supposed to get rid of the black market, and it's supposed to make law enforcement have a better life, perhaps, not chasing down cartels. But that isn't the case. We have there was a bust in Colorado Springs that had ties to El Chapo. Burglaries at dispensaries in Denver hit a 3-year high, no pun intended, in 2019. So last year, the robberies at the dispensaries in Denver were at an all-time high. Homicides in Denver, 2018, had the highest number in 14 years, since 2014. So it's breeding crime in our communities. Officer-involved shootings, 9 in 9 months. 6 of them were fatal. Colorado Springs, we had 7 shootings, 5 of them deaths. The state of Oregon, the Secretary of State of the state of Oregon did an audit of their marijuana program and released that, and it's available. I can send it to you. They were only able to test 3% of their stores for compliance. 3%, and only 1/3 of their growers had a compliance inspection. So the state of Oregon said, we cannot ensure that the test results are valid and that the products are safe because there are contaminants in here. There's no public service announcements for a contaminated product. I mean, the only public health department in Colorado that has recalls is the Denver Public Health Department. The only way you can find it is you got to go to their website, you have to sign up for the email. But by the time I get an email, if I went to Denver and bought some pot, and by the time I got the email that don't use the pot, it's probably already been consumed or shared among friends. But the state of Oregon, I mean, they have a tax and regulate system, but they can't even control their own programs. They can't have reliable testing. I mean, some of these, the contaminants that you can find, if you use mycobutanol, nobody's heard of mycobutanol, it's a fungicide, you know, to keep the fungus off the plants, you've heard of it. But what happens when you heat it? Turns into hydrogen cyanide. That's not good, right? It's not, I mean, not every product's contaminated, don't get me wrong. I mean, I'm just trying to bring up a point that there are contaminants. Medical marijuana in the state of Oregon is not required to be tested either. Here's some of the homicide data in Colorado Springs where I live. And I do a lot of work with law enforcement, DEA, the sheriff, El Paso County, et cetera. In 2018, I think some of the data is somewhat flawed because one of the officers that I know that I worked with in V&I, Vice and Narcotics Investigations, he told me that in 2018 there were 0 homicides in Colorado Springs related to marijuana. So I went on their website and I kind of went through the data because that's the way I roll, and I found 2. There were 2 people murdered at the same time in Colorado. And I said, hey, Sean, you had 2 in 18 that I found. He goes, then there's 2, right? So there's probably more, there may be more. 2019, 12% of our homicides were marijuana related. Here's our violent crime data from Colorado Springs over time. Our violent crimes are going up. And our population is growing, but it's not growing at that rate either. So this is like the U.S. Postal Service. I mean, this is kind of goes along. Again, I'm a visual type of learner. This comes from the U.S. Postal Service, and you look at commercialization and legalization, and the amount of parcels that people are mailing through the Postal Service is going up. The average poundage of marijuana from Colorado to other states is going up. I mean, it's just, I mean, to me, this says a lot. And again, if I say something you may not like to hear, I'm fine with that, but send me the data, and I mean, because I want data. I want to know what I don't know, because there's probably a lot that I don't know, and I want to know more. This was a tragedy that happened a month ago. This young woman lost her son because she was divorced. She lived in Texas, but the dad needed visitation rights. So she drops off the kid in Canyon City, which is about 45 minutes south of where I am. And that he was charged for cultivating more than 30 marijuana plants, because Colorado math, you can have 6 plants, 3 flowering, 3 non-flowering. Who's checking on that? Nobody, right? So Colorado 6 equals 600. You know, they will say, well, no one's going to look at me, and I'm going to just grow whatever I can and sell it to my friends or just give it away. He had concentrate. He found a butane hash oil extraction lab inside his mobile home. When my parents had a house on Lake Bomoseen, I lived in a mobile home. I know how small they are, right? So half the mobile home was filled with marijuana plants, marijuana paraphernalia, extraction devices. He had a loaded Ruger in the pantry next to the mac and cheese with the 3-year-old there. Had an AR-15, a hunting knife, and this kid's just kind of walking around. So he decides to leave, and his neighbor caught him on camera. So at 10:30, he runs over his son, and then he leaves for about 14 minutes and comes back and then picks up his dead son and brings him he didn't go to the ER, he went to like a firehouse or something like that. And so then he goes, yeah, I kind of dabbed earlier in the morning. And he said, okay, on a scale of 0 to 10, tell me the most high you've ever been. Where are you? He said, I'm on 2 or 3. He wasn't sober. If you admit to 2 or 3 out of 10, you're still a little high, I guess. He has experience. The state of Texas represents about 10% of the entire country in population. So I think it's a good representation of kind of the country, you know, taking the politics out of it. But if you look at child abuse or neglect fatality in the entire state of Texas, if you look at the substance, active or past use by perpetrator, marijuana is screaming out there, followed by nothing, followed by alcohol, cocaine, and meth. Why is that? I mean, this comes from their state website. You know, anytime you have a dead kid in the state of Texas, if there's a substance involved, or even not a substance involved, because that's number 2, is nothing. But the primary substance found in a dead kid from abuse or neglect in the state of Texas is marijuana. You can go to the website and look it up. So here's the Russian money coming in. Giuliani's, you know, trying to get a money grab here. You know, they have Colorado relationships. So the Russians are pouring money into the U.S. to open retail marijuana businesses. So here's our law enforcement folks. So here's our 6 plants, right? 6 equals 6. 3 flowering, 3 non-flowering. You know, I don't think that happens. And the problem you have is that we have so many foreign nationals in Colorado. We have Russian, Laotian, Vietnamese, Mexican, Cuban, you name it, they're there. And they hide in plain sight under the law. They're wearing hazmat suits, right? And the folks I work with in law enforcement say, well, they go to these homes and nobody's really living in them. People will drive up and tend to them, and they're finding plants in the toilet, in the bathtub, in the wet bar, all over the house. And again, it's not 6, right? It's not an ounce where you can walk around. I can walk around anywhere in Colorado with an ounce of marijuana, you know, and that's why the concentrates are going to become one of the reasons concentrates are being more popular, because they don't take up a lot of volume, right? An ounce is an ounce is an ounce. An ounce of pot, an ounce of bud flower is going to be a lot bigger than an ounce of concentrate or shatter, right? An ounce is an ounce. So here's they are. They're wearing rebreather masks, and they're wearing hazmat suits. And why is that? It's just a plant, right? Well, maybe they have mycobutanol on them. Maybe they had one of my patients, a DEA agent, a big dude, and he ripped his suit. There's a little hole. And he's like, you know, I was in this grow and I was removing plants. That's not him, but I was removing plants, and I think I got a contact high. Because like I had, you know, it was maybe the oils were coming through the hole in my hazmat suit, and I felt a little dizzy, a little lightheaded. You know, was it an oil that he got? Was it a pesticide that he got? Was it another chemical that he was exposed? Who knows? The ER physicians down in Pueblo are seeing people come in, law enforcement in particular, coming in with unexplained rashes. I've had a rash for 2 weeks, and I can tell you that the folks I know, first responders I work with in my community, say they go out all the time. Every single night they have to wash their clothes because they smell like pot, even though they may have had 0 calls related to marijuana. 0 calls, but every single time they have to come home and wash their clothes because they reek of marijuana. They go to the domestic violence call and they're in an apartment with the windows closed and the air conditioner's off and they're hotboxing in their apartment and they smell every single shift. This is what they're finding, our law enforcement folks. And I love Christmas, a Chevy Chase, Christmas Vacation. I like the more lights, the better, right? So my wife hates it because I'm like stringing these surge protectors. Again, she's like, no. So I come home, they're all disassembled and there's like one plug and that's it. And I'm like, that's not Christmas, right? But this is somebody's house. These are the elaborate electrical systems that they're finding in people's residential homes. And it's interesting because some utility companies will not cooperate with law enforcement on this. It's like that whole block, everybody on that block is about $200 a month in electricity, but that house is $11,000. Seriously, I'm not lying, I'm not exaggerating. This is what they're, and so the Black Hills Energy won't cooperate with law enforcement and say, hey guys, there's a problem here, right? And apparently if you hit $10,000 a month, you become a commercial business or something like that. So what they're doing is, because it's a cash business, the resident will go to the utilities with a $9,990 worth of cash and then write a check for the difference so they don't get flagged as a commercial enterprise or business. These are some of the electrical findings that they have they're very elaborate. Trouble for first responders. If this house catches on fire and there's a person that's on the ground from smoke inhalation, you have this little crawl space to get in there. There's tripping hazards. Butane hash oil explosions happen. Wildfires have started as a result of BHO explosions. So there's entanglement hazards, there's tripping hazards, right? These are some of the commercial grade lighting and heating elements that they have in residential homes, right? Drywall is not a good medium to grow a crop. So they have issues with mold, which I'll show in a second. But I didn't know this. An agent in charge in Denver told me that when houses are modified like this, there's no marijuana registry like they have for a meth registry. When you have a meth house, that has to be disclosed. When you're buying a house, yes, this was a former meth house, but they fixed it. In the marijuana world, you don't have to do that. So they're punching holes in drywall, they're ventilating the house. These are all the vents outside through the stairs. You don't have to report that. So that person leaves, they did their thing, they rented the house, they grew their plants, they left, but they patch it up, they paint it, smells nice and brand new, but your R30 rating becomes an R5 rating. And the new young couple with 2 young children don't know that they have 5 minutes to get out of the house instead of 30. It happens. This is in Greeley, Colorado, where there was a big residential grow. There's the mold oozing out of the house and in the ceiling and the drywall. That's all mold, right? Again, drywall is not a good medium to grow crops. You don't do that. Cannabis workers, this is from the Journal of Industrial Medicine. A lot of my patients go to these dispensaries for advice. They want to know something, they have a back problem and they say, I will go to the dispensary and I want to know what I should use or what I should avoid. But the dispensary workers that smoke 6 to 7 days a week, 23% are smoking before they go to work, 14% during work, and 53% after work. A lot of them are smoking all the time. So would you want to take advice from somebody that may be using marijuana on a regular basis? The problem is, like my patient, the heart transplant patient, and I had a patient last week. If you go to drugs.com and you look up cannabidiol, we know a lot about it. It has 500 drug interactions, 9 of which are major, one of which is buprenorphine, which is, in my world of pain, that's what you use for medication-assisted treatment for opioid use disorders, buprenorphine. But then you have somebody using CBD. If you don't know that there's a major drug interaction there, you might cause your patient harm. Coumadin, there's a lot of elderly people that are on blood thinner Coumadin or warfarin for blood clot or AFib. They're on a blood thinner. CBD has an interaction with Coumadin. So their INR, which is an indication of how thin your blood is, can go up. There have been reports of INRs of 8 in our emergency department. That's, don't pass gas or you'll stroke. I love Vermont. I spent a lot of my youth here. It's a great state, great people, right? But the dean of students at Marquette University was killed last week from a stone driver. That's last week, or February 12th. So you don't want the dean of UVM. I wish he was here because he want police escort back home. But the dean of Marquette University was killed by a stone driver a few weeks ago. And if you look, and it's interesting because, I do give Colorado a lot of credit because they are tracking data fairly well. They actually look at the time of day that people are killed, day of week, month of year. Obviously summertime, probably a little more prevalent, but the people that are dying related to marijuana-related driving fatalities, typically during the day, we have more pedestrians and bicyclists. I'm a big biker, a big mountain biker, but it seems like during the day and the cyclists and the pedestrians are getting run over by stone drivers more than drunk drivers. Drunk drivers tend to be more in the evening and on the weekends, tend to be. So here's my CBD, and actually the FDA just came out with a position earlier this week. Shouldn't use CBD and drive. It can cause a sedation. When you have safety-sensitive employees, you got to be careful. Driving school buses or, whatever, flying planes, be careful when you use CBD. It's not going to get you high. I want to be very clear. It's not psychoactive. But again, it's not benign. And again, if you go to the Epidiolex website, which is purified CBD, these things are noted on there. There's suicidal behavior and ideation. There's sedation, lethargy. There's effects on kidney and blood and liver. CBD can cause sedation, sleepiness, and lethargy. And a lot of these products, I can tell you, have THC in them. Despite as much as they want to test and verify it's pure. Charlotte's Web. Anybody heard of Charlotte's Web? Charlotte Fiji was a young girl who moved to Colorado with her mom, Paige. And they live in Colorado Springs. And, even though the entire population of Vermont can fit in El Paso County, Charlotte's stepfather is a friend of mine. I go mountain biking and skiing with Greg. So the great family, and anybody, I would do anything for my kid. Anybody here would do anything for their kid. So I get it. I understand why they moved, because this kid was seizing all the time. But now we have Epidiolex, right? So here's Charlotte's hemp product sold at a grocery store in Evergreen, Colorado. They are really expensive, right? It takes a lot of plant product to make a little vial of oil. There's no labeling. It doesn't tell you anywhere on this label how much CBD is in it, how much THC is in it, right? Some of the products are about the equivalent of the cap of NyQuil, 30 cc's. So that's a cap of NyQuil. Just, take a drop. There should be 30 drops in there. That should last you a month if you're taking it once a day, right? However, here's the certificate of analysis of Charlotte's hemp oil, 30 cc vial of maximum strength mint chocolate hemp oil. That has 84 milligrams of THC in it. That's a lot. Does anybody know what a dose of marijuana is, just by curiosity? Anyone? 10 milligrams. Actually, Jerzy Slavarsky and Tyler Gaston from the University of Alabama wrote my seizure chapter, and they looked at Epidiolex, and they did talk about hemp and artisanal preparations. They do not recommend it. And these are the leaders in the world of seizure, pediatric seizure, that did the research and are contributing to my book. In Colorado, there is no cap on residual butane in hash oil. So our committee wanted to put a cap on butane, residual butane in marijuana product. So nobody wants to ingest, heat, vape, eat, tincture butane, which is cigarette lighter fluid, right? Nobody wants to do that. So, but in Colorado, they said, we're not going to put a limit on the amount of residual butane in our products. But my point is that there's not good labeling. A person that may have a heart problem or another medical problem that may have, I had a patient who has a marijuana allergy, which I can get to later, true allergies, an EpiPen. But this is what's in the product. They need to be better at labeling these products, not because there's an entourage, there's no such thing as an entourage effect. I'm not arguing that. My point with this is that there's THC in products being sold over the counter at a grocery store, not a dispensary, that has THC in it. And the amount of THC sold in this hemp oil product at Safeway is far greater than what is allowed at some of the other recreational stores. So in terms of driving impairment and fatalities, the state of Washington, the fatalities have doubled. Drivers who are driving high are twice likely to be involved in a car crash. Legalization of recreational use of marijuana may increase THC-positive drivers and fatal crashes. And the survey of 11,000 people, marijuana users in the state of Colorado, 70% say they drive high. You know, people that drive high all of them aren't going to get in a car crash. People that go to the bar, that have a beer or a glass of wine, are not going to get in a car crash. You know, the vast majority of people are not being run over in the state of Colorado. The point is that marijuana can cause impairment, reaction time, depth perception, those sorts of things. You know, in Colorado, they say that the alcoholics stop at the red lights, but the marijuana users stop at the green lights. Have you heard that one before? But if you look at, you know, the consumption of alcohol, because they say, well, instead of going home and having a glass of wine or a pint of beer, I'm going to go home and smoke a joint. You know, I don't really care what people do at their home, right? But in Colorado, it's going up. I mean, we have a bunch of alcoholics in Colorado because since legalization, commercialization, the gallons consumed in the state of Colorado based on the DOR excise tax data continues to go up through 2018.